My name is Dr. Scott Naftalin. I'm a physician at Northeast Rehab. Here in our Lehigh Valley Bethlehem office, we're able to perform procedures that people will frequently have done in a different setting, such as a hospital or surgery center. And the costs associated with treatments at those other facilities is much greater than those in an office setting. We follow all of the same quality standards that you would receive in a hospital or surgery center. If you need some type of sedation, we can alternately perform it at a surgery center facility. But generally, the cost, comfort, and convenience of doing it in the office for most of these procedures is much better at our facility versus one with a hospital.
Hello everyone, my name is Cynthia Blair. I work at Northeast Rehab here in the Bethlehem office. What I like most about this office is we're like family. It's small, so it makes it private. We have a good time here. Everybody works together as a team. I love the doctors here. The doctors are very friendly. We learn a lot from them. The coolest thing about my job, I would say, is some of the patients that come in. Some of them are funny. Some of them, I like their sense of humor. Some of them bring in food and delicious treats. I love that. So I'm looking forward to being here many, many more years.
Hi everyone, I'm Lisa Gatto. I'm the CEO here at Northeast Rehab, and I'm here to tell you some exciting news about our Bethlehem office. Coming this June, we're going to be moving to a new location at the Bethlehem Medical Arts Center at 5325 North Gate Drive in Bethlehem. We're going to be providing all the same wonderful care that we provide here in this office. We're looking forward to seeing you at our new location.
Hi, I'm Dr. Bruce Strong. I'm one of the new physiatrists here at Northeast Rehab. I specialize in interventional spine, so I treat the whole array of pain throughout the spine, including the neck, the mid-back, and the low back, in addition to other joints. I perform X-ray guided injections, ultrasound guided injections, and also diagnostic nerve tests help treat the source of pain. I'm super excited to be here, and I work out of the Scranton and Bethlehem offices.
Hi, I'm Leslie Saylor. I work out of our Bethlehem office. I am front desk medical administrative. Been here over 13 years. See, when you walk in, I will do the check-in. I'm also the person that you call on the phone to schedule your appointment. And I absolutely love working with the Bethlehem office. We have a great staff, great doctors. The best part about working in Northeast Rehab is we have a small knit office and we're very close. We lean on each other, we laugh, we cry. We're always here for each other. That's why I love working here.
Hey everyone, this is Matt Scalise, physical therapist, speaking to you from the Greater Scranton YMCA, where we have a PT clinic. Many of you, I'm sure, are in need of stretching your hamstrings. So I want to talk to you today about some common dynamic hamstring stretches, things that you might see if you show up at a sporting event and you watch the team warming up. It's even great to do if you're warming up for a spin class. So my favorite dynamic stretches for the hamstrings include some of these. Staying up nice and tall, twisting your upper trunk while reaching for your toes. Another option is you're going to be reaching up towards the ceiling, reaching forward. And then the last one include what we call hamstring sweeps. These are things that you could do maybe 3 to 4 repetitions of each exercise, and it's going to be a part of a more inclusive dynamic stretching program.
Hi, I'm Amanda Yesvitz. I've been with Northeast Rehab since 2010. Coolest part of my job is I get to help patients in pain feel better. I like working with my patients. A lot of my long-term patients have become close like family to me, so I get to see them regularly and help them feel better.
The Bethlehem office is a wonderful place to work because it's a smaller office and we get to know the patients and we get to interact with each other on a much smaller basis, and it becomes a lot more personal. The doctors here are really enjoyable to work with, and we get to be almost like a family. It's a team effort when we're here. The company is a wonderful place to work because they do keep all of their employees in mind. They speak to us on a personal basis and they address any needs that we have.
Hello, my name is Dr. Scott Naftalin. Here in our Lehigh Valley office, we're affiliated with all of the local networks, including St. Luke's University Health Network and Lehigh Valley Health Network. So we do give you freedom of choice regarding where and who does your procedure. We have the same expertise. I'm fortunate enough to be an instructor for the Spine Intervention Society, an international organization where we teach physicians how to perform these procedures with the best quality and outcomes. By coming to a facility like ours, you'll have the same service that you would have at a larger institution, but again, that freedom of choice in a more comfortable environment. And so we would hope that you would consider us for your care in the future.
Hi, my name is Mark Ford. I'm a physical therapist assistant here at Northeast Rehab Physical Therapy. Have you ever just got up out of bed and pulled a muscle? Has your back just hurt? Here at Northeast Rehab, we have a tip that we want to share with you. It's called the log roll method. This is what you would use to get out of bed. So with one leg propped up, you're going to roll to your side, and then you're going to drop your legs off and utilizing the same arm that you're rolled onto to push yourself up in order to keep your spine in neutral, as opposed to just sitting up out of bed. A lot of times people just kind of thrust themselves forward up out of the bed, and that puts a lot of strain on the low back. So by utilizing the log roll method, it will actually help to keep the spine in neutral and decrease the amount of effort that's required out of those low back muscles.
Some of the services that we offer here is pain management. We specialize in helping you get better with your pain as far as leg pain, back pain. We do injections for your pain. Most of the times our patients that we have scheduled, they are satisfied because we can get them in sooner than some other places. So I think we do a pretty good job of getting the patients in.
Hi, my name is Taryn Melody. I'm a physical therapist here at Northeast Rehab, and I love treating all patients, especially athletes. I've been an athlete my whole life, and as a former basketball player from the University of Scranton, I know firsthand how devastating an injury can be to a student athlete. A very common complaint I see in the area are female athletes that have a lot of knee pain. So if you are an athlete, or if your daughter is an athlete who's experiencing knee pain, good thing to look at is core strength and hip stability. So a good PT assessment could look at the core and try to help to prevent and treat those knee injuries that you have. So during a session with a physical therapist, we would take a look at your core strength by testing your ability to hold a plank. We'd also take a look at your hip stability and strength, doing single leg squats, also the flexibility of your ankles. So all of these things would affect the knee pain that you're experiencing when you're playing.
Hello, my name is Dr. Scott Naftalin. Some of the diagnoses that we treat are those that people hear of every day: disc herniations or degenerative disc problems, sciatica. We also do some of the more advanced procedures. So if you're suffering from neuropathy, especially if you're diabetic, we can manage it with medications. We can also work with spinal cord stimulators, which have shown to be effective in the treatment of these conditions. And then if you're older and suffer from lumbar spinal stenosis and can't tolerate that walk from the parking lot to the store, we can do minimally invasive procedures which don't require general anesthesia or the potential risks associated with that treatment in an outpatient environment. So look us up and we'd be delighted to try to help you out.